I am Dr. Thompson, Akwo, Ntuba, international physician, certified professional and expert in global health, USA. Subspecialty, Medcoms, so health and medical communication. Covid-19 updates. COVID-19 updates. Around the world as global health experts continue to communicate the risk and the evidence so that you can make healthy behavior choices. I want to assure you that global health leaderships around the world is working 24 hours a day, 7 days a week, many months and almost 2 years in making sure that policy, protection, promotion, health therapeutic interventions, and development issues related to COVID-19 are all addressed. Be they developmental skill buildings and training around the world that is done by the World Health Organization, the established medical centers around the world like Johns Hopkins in Maryland, the others in South Africa, in Asia, in Europe, in Germany, France, the United Kingdoms, and Russia, in all these countries. First, we want to make it clear that this come to the notice of global health experts around the world, that some countries are refusing to accept the COVID vaccines which have undergone the World Health Organization clearance in terms of safety, efficacy, and approval. A good example for now, we know that we have predominantly 3 vaccines which are in circulation in the United States and which are being used to vaccinate Americans. We have the Pfizer vaccine, we have the Moderna vaccine, and we have the J&J, or what they call the Janssen vaccine. But those 3 vaccines are not the only vaccines which have been approved for usage by the World Health Organization. And some of the almost 7 or so vaccines which have been approved coming from different regions of the world and these countries are acceptable. And member states of the United States or of the United Nations, I meant to say, including the United States of America, the European nations, the European Union, and the members of the European Union, the United Kingdom, France, in the European Union, Germany, and all these other countries cannot afford to say that those vaccines which have undergone the World Health Organization approvals are unacceptable as travel requirements, because there are countries that are already beginning to complain in South America and other places that they're having these issues of travel restrictions because certain countries are saying that certain vaccines which these people get, they are unacceptable in those countries. We as global health experts and communication experts who communicate COVID-19 risk and science are actually saying that countries should stop these discriminatory practices, sounding the World Health Organization, sounding other experts in great research institutions around the world. The time has come when the world must begin to respect the decisions of the bodies that these nations belong to. You cannot pick and choose. If you are a member of the United Nations and you actually hold a membership in the World Health Organization, you as a nation must respect the decisions which you yourself took in your World Health Organization. So there's nothing like there are certain vaccines which are unacceptable. All the vaccines which have been approved for usage by the World Health Organization are acceptable for travel. And this may require international courts coming to look at these disputes if need arises. Because there are nationals who have the resources, who work for the World Bank and other places in those countries that you are trying to discriminate at. They have the resources, the legal backings to take you to the international court in The Hague where these mediations are done. And so the issue of vaccine or vaccination and travel has been addressed properly, and we are echoing the voices of the global health leaders in the world that nations cannot, and I repeat, nations cannot afford these discriminatory policies they are putting in place. The time has come where the decisions of the World Health Organization, the decisions of the United Nations must be respected by member states. We don't have parallel governments for the United Nations or parallel governments of the World Health Organization. All those agreements at the level of G2, G7, G6, G8, G20, G30, G40, the world actually doesn't actually look at those as the decisions of the World Health Organization and decisions of the United Nations General Assembly or Security Council. If people are forming all these parallel unions by the side so that they can work with their cliques and be able to create problems in the world, they should know that countries that are not part of those groupings have the right to form their own groupings or to challenge the decisions of those groupings. We know that China has been talking against and about the decisions of G7, but it wasn't G7 before, it was G8, and Russia was kicked away. And so these problems have a way of floating and coming to the United Nations General Assembly. They have a way of coming to the World Health Organization's Assembly and other bodies that are acceptable bodies that the world has come together under. So COVID-19, vaccination and travel has been addressed. And so far, the world, under its World Health Organization, has approved a number of vaccines. And anybody who has received complete vaccination of any of those must be allowed to travel. Testing is going on around the world. The world is dealing with new variants. There is the Mu, Delta, Gap, and the others. But it is not more of the new variants, because if you've studied virology or parasitology or microbiology or clinical microbiology, we know that viruses mutate. So mutation is not a problem. Mutation is not a fear. Mutation is not that which gives us headache. The problem is the inequity in the area of vaccination. And where does that come in? It's not even the fact that nations don't have money to buy the vaccines. It's the fact that the companies around the world that are producing the vaccines are playing these games where they are trying to make sure that they continue to serve the so-called rich countries in the world. So much so that they are ready to provide them with enough boosters. When we don't have enough vaccination, even for healthcare workers, for low and middle income countries around the world, the global health leadership says that is unacceptable and it must be reviewed. Because if that doesn't happen, we will find ourselves in a situation where we have this false security. We have vaccinated 80%, 90% of our population. We are beginning to do booster vaccination. And so we are secured in America, secure in Britain, or in Europe, or all these countries. And so let me tell you, and let we, the global health experts, continue to echo this to you. If we don't secure the health of the global community in the different countries that the people are, with vaccinations of those who are needed to be vaccinated, as they are talking about, they need to move from 20% to 40% in almost all the countries sometime by the end of this, or by sometime mid next year, or 2022. There is need for countries to begin to mobilize the vaccines that they are keeping, especially those that you are keeping, to vaccinate people in the name of booster or boosters. Let us redistribute those vaccines to places where people have not even given first doses, to their healthcare workers, to their vulnerable communities, and other subpopulations within the communities. Because taking care of these people where they belong is an opportunity for the health systems not to be overwhelmed, so that global health experts can continue to do their work. So, America, Europe, and European countries have the right to booster vaccinate, but at the expense of their own populations. Because there is nothing like herd immunity when the virus is floating around in low and middle income countries around the world. Because we live now in a globalized, non-border context. Nobody is safe until everybody is safe. Nobody is free until most are vaccinated around the world. And as the global health experts are saying, the world has the resources to be able to vaccinate the people who need these vaccines at this point in time. There are those issues which are being addressed at the level of countries. As global health experts, we are looking at all the regions, but there are no doubt we operate out of certain countries. I live and operate in the United States, and so I have a tendency of telling you what is happening in the United States, what to me is best practice from my experience and training and certification in global health profession, and as a global health expert. Infectious disease work, vaccination is part of our work. I have been telling some colleagues that we are coming to the place where what they call the expanded program of immunization and other national immunization programs will actually include, because we are not very sure if this virus is not going to be with us like other viruses that we are dealing with year by year, like the influenza, the flu. There are people who are vaccinated every year. So if it comes to the stage where nations have to vaccinate their people every year to fight SARS-CoV-2, no problem, that is fine. But as the world has come together in solidarity, working, there is need for the world to make sure that it uses a global health approach in tackling and controlling this deadly pandemic. There are differences in policies as to school children, but we are seeing that there are increased cases of COVID hospitalization and infection among children in the United States, and the global health experts, Anthony Fauci, the CDC, Walensky and others, and those who are involved at the state level and county and departmental levels are putting their heads together. At the national level, we were having meetings and, webinars and conferences, and we are supposed to actually communicate the risk and the evidence to you the right way. So what I continue to say is that let equitable vaccinations continue. And so far, some of the places where we had a lot of hesitancy, especially in southern states, United States, Alabama, and some of those places, suddenly there is a high increase of vaccination, because it's been said that a lot of people who are being hospitalized, some who are dying, are actually people who have not been vaccinated, until people have come up with this appellation that it is now a pandemic of the unvaccinated. I don't actually agree completely with that. That may be a misnomer, because that may create its own problems. We also have breakthrough infections. Those people are already vaccinated. So why would you have a breakthrough infection? There is provision for that, because when we talk about the effectiveness of vaccines, we talk about 92%. There is an 8% window that you may not have the vaccines work. There's 8% of the population out of that. So if you calculate that, you then notice that what you call a breakthrough infections are supposed to be there. And that was actually fed in the research. But it is said that the severity of breakthrough infections, listen, we say breakthrough in the sense that these are infections which are found in people who are already vaccinated. But the outcomes and severity in breakthrough infections are good. Hospitalizations is not much. The morbidity or the clinical presentation is mostly mild or moderate, not very severe. So get vaccinated. The world is working. The centers in America are working to make sure that children beyond 12 years old may be vaccinated. There is also research that is going on, so that we may have as the inhalers or spray or whatever, instead of the injections or the shots. All of that is ongoing. So far, so good. The world has the tools in the toolbox to take care of COVID-19. The COVID-19 long haulers, their own cases are also being addressed. So testing is going on, especially for the low and middle income country. The emphasis is for people to actually respect the public and social health measures which were put in place. Testing, contact tracing, respiratory hygiene, wearing of mask, social distancing and things like that. When that is done, you give yourself time so that your health systems are not overwhelmed, and then the scientists and the people can continue to do the work so that we beat this problem. And so I am saying that we've lost a lot of people around the world from the global health perspective. But so far, our hospital systems are doing very well. We experts in global health are doing our work. Those of us who subspecialize in medcoms are communicating the risk and the evidence as we work with the World Health Organization, the CDC, and the NIH, and all the PAHO and all these bodies around the world. So let us cooperate. Let's work in solidarity. Let us listen to what the experts are saying at the United Nations and WHO. And even as the United Nations begin their UNGA 2021, or the United Nations General Assembly, this COVID-19 will always also be discussed, and the leaders of the different nations that are part of the UN will make their contributions, will be able to exchange best practices. Thank you very much.